Testing 1, 2, testing. Government and Public Engagement Committee meeting, April 15th.
We don't have anyone online, so we're not missing anything.
All right. This is the Government and Public Engagement Committee for the Fallbrook Regional Health District on April 15th at 5:40. Sorry, up night. Okay, we've had the call to order roll call.
We don't need a roll call because you're both present.
Very good. No public comments.
No public comments.
Very good. So, we'll go through our discussion items and then rotate back to other
Sure.
goodly things.
Yeah.
Debriefing of Congressman's Mike Levin's town hall. Were you there?
No, I didn't.
Annabelle was there.
No.
Cindy, no,
Cindy.
I mean, sorry, Cindy was there. And you were there?
I was
No,
not there.
I was there. Oh, so I'm the only one.
And Raquel was there.
Oh, good.
Yeah.
Yeah, you know, yes, you were.
Yeah. And Howard.
And Bianca was there.
Mhm.
Okay, so, it was fabulous. In 3 ways, I'll say 3 ways. I think there were probably, do you think there were about 80 to 90 people there?
Yes.
Yeah. And, he was able to tell us about where the hangups are back in Washington. And that helped us make sense of why things weren't moving. It didn't placate us, but at least it wasn't a mystery. He also talked about his biography. He's the only congressperson who is a member of both the Latino and the Jewish affinity groups. His dad, his paternal grandparents came over from Mexico and crossed the border and started a jukebox business. Yes. Because have we ever seen one lately?
No, because you do it through the app on
And
your phone.
that's the jukebox. And they became very famous and were very successful. And then his mother's side was Jewish. And they fell in love and they had children and they had all of that and grandchildren
Los
and great
Angeles.
grandchildren. So that was kind of a funny, beautiful part of his personal story. He has 2 kids, which I like, teenagers. So that's a good grounding force. And he's moving in. The big deal is when you go back there, when you start, even if you're senior here, you're junior there. So like Dim Desmond, if he wins, he will be junior. He will be on the total outside. I don't know how he's gonna stand that because he's always on the inside. Sure, I mean, senior. But Mike's been there long enough that he is on the 2 of the biggest committees. One of them being the Appropriations Committee, decide where money goes. And the other one I can't remember. But he's very excited about moving up in those ranks so that he has more influence for us, for all of us. He seemed very familiar with the work that we do here. He has been informed about Fallbrook as a town to be reckoned with in terms of, we're active, we vote and all of that. So we're new to him because he is a new,
With the new
Prop 50,
boundaries.
we ended up with getting a new Congress position or person. So, what would you say, Raquel?
Veterans Committee, he's a part of the
Thank you,
Veterans
he's on the
Committee.
Veterans Committee. Yes, thank you. That's
He
right.
was great.
Very engaging,
Yeah.
very knowledgeable, very enthusiastic, go-getter, knows how to hold them and when to fold them. And you gotta know that in politics. You can't just bully your way out of things. Apparently. And so he wished us well and he appreciates us and he's looking forward to many more interactions with us.
I mean, I didn't have a chance to meet him, but I did speak with our representative, Chris Palmer at CSDA, who represents our area. And he has worked with Mike and Mike's team for a long time. And so when I explained that we're going to be moving into that district, and that we definitely wanted to make a connection.
Literally, I think the next day is when Adam, Mike's guy, started calling us. I was like, well, that was fast. So we'll still have conversations, I think, especially after the election is over. We'll want to make sure that we're engaging with those members, especially as we start coming potentially forward with financial asks, as it comes to development for services and programs. So it was nice that that first entry from him into the community was so well received. Yeah.
When you say the meeting or the.
Democratic Club.
Yeah.
They call it the
Like they might-
Democratic Club.
Okay.
And for anyone who potentially watches the video, we are a nonpartisan organization, obviously. So if the Republican club came to us and said, we want to use this for a town hall, we would make that available. The idea is Mike is this current sitting congressperson, assembly person, congressman. So they automatically get, if someone is coming into town just to hold a political rally, that's a whole different conversation. A political rally, they would have to rent it and it's on their own, they'd have to pay for it. We were helping to make this a community resource because this is a sitting congressperson. So that's just a very
Subtle difference in case somebody wonders about the politics.
Right.
Well done. Just to be clear.
Okay, changes to, just when I was getting used to it, changes to the district website. Please tell me.
So Jasmine and I, both for quite a while now have been, well, actually Teresa as well. We've been quite frustrated with Streamline, which is the entity that hosts our website, right? There's not a lot of flexibility to it. There's just some challenges, right? You can't make it pretty. That's her biggest challenge. The calendar function for the Wellness Center is Teresa's biggest
Hate point on it. Streamline has been good. We were an early adopter with them back in 2017, 18, something like that, I think. However, there have been some new laws. One of the newest laws, about a year ago, is that the PDF one? It was about a year ago now? Had to do with an accessibility, which meant that any, and I'm gonna shorten this down for some of the details. Any PDF that is on your website has to be marked fully accessible, meaning so that if a blind person logs onto your website, the PDF can be read out loud. All right. There are some significant challenges with the technology and the process for this. The example here is when we do our finance packet, we include the statements. Those statements we cannot alter to make accessible. The banks and the other entities, they're not required to make them accessible. So there's no way we can fix this. Now, Streamline offers a service that would make all of these PDFs accessible for $20,000 a year.
On top of what we already pay.
Which is about 10 to 11,000 a year. Now, I already told Jasmine before she even had a conversation with Streamline, like, that's not gonna happen. That's not gonna fly. We can't afford to do that. So we finally got on a call with them. I kicked and screamed and stomped down the hall and finally joined the call. And I explained to them that that's not a viable source. I understand that we are working toward that. We are trying to fix, we are adjusting everything we can. Back in the day when Linda was managing the website, Linda didn't have quite the technical skills. So we end up having how many pages? 900 pages?
Yeah. There's a lot.
We actually have 900 pages embedded to our overall district website and something like 40,000 PDFs.
Yeah.
Now, a lot of those are old board packets. They are flyers that we made as a PDF instead of an image, some technical things. So we're working to clean that up. We're working to try to make it more user-friendly. We're looking for an alternate vendor. We're looking for a source that will be more centered around the services and programs that the district offers, which is primarily the Community Health and Wellness Center, right? Streamline and our current website is really focused on the compliance of a government entity. Those two don't flow together real well. So just know that we're spending a lot of energy looking at that, and I'm mostly pointing to Jasmine because she's spending a lot of energy on that, and then I come forward and say, nope, we can't afford that, and nope, I don't like this, and nope, 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 and she says, I hate this part, and so we're trying to find a better tool. The website is functional. It's good for a lot of things, but it has a lot of stuff that doesn't fit for us as well. And we're bringing that to this committee so that you're aware, we're researching it, we're looking for it, we're trying to find a way that will be better suited for community engagement.
Do we have like organizations whose websites we admire to find out who they're using?
We have, some of them have used other, website hosts. So there is, I think it's called Granicus, which is very similar to Streamline. A lot of cities as well as fire departments, the police departments, they use that because it's, has that compliance.
Basically, organizations with very large budgets.
Yeah, that's more expensive. So we're kind of trying to find a middle. So I would consider Streamline a little more very rigored. So they, like Rachel mentioned, it's very much about the compliance, but now I am shifting it more to user friendly. So what community members use, because those are really the people, like, they can't find anything on our website.
Yeah.
There's no benefit. So,
Right.
we appreciate how a lot of the compliance is built into Streamline, but just having conversations with them about certain features and trying to understand why it was built this way and when would this come online, it's just been a little back and forth. And right now we're wondering, like, do we stick with Streamline, or is this the time now where we can start looking at some other website hosts that are now also working with other cities and government entities that are kind of around the same size as us to make that switch?
Well, it makes sense that it would come to us for the engagement component, right? So I like the fact that you're looking at the end user perspective, not the internal user, but the click beyond that, because if we don't reach the public, we're not connected, right? We're not engaging. So I appreciate that part of the inquiry.
Yeah, I mean, it's, that if we went with a traditional outside, website that has all the bells and whistles that are pretty, like a WordPress site, it takes more technical expertise to run it than our current. Streamline is very easy from a technical standpoint. Plug and play, anyone can do it. But if we went to WordPress, it would take much more time and expertise. It also wouldn't have any of the compliance. And right now the compliance is important because Raquel has to make sure that our enterprise system catalog is up on there. We have certain requirements of special districts that we have to have on our website. Well, Streamline makes that very easy. It's like, no, you have to have this piece of paper. You can't go any farther until you put this on there. And then they can't, and it makes it easy for us to be compliant.
Exactly.
So we're trying to look at what those needs, processes are, our needs internally, but yet still valuing that important engagement piece. And so we're really trying to be thoughtful on it. So in case you do hear anyone that says, did you hear about the PDF law? You guys are, PDF police aren't coming at us. We know that, but we definitely want to be able to be accessible to anyone in the community who does have a visual challenge, auditory challenge, anything where that adaptability to a website, but there's no way to fix these PDFs. And yes, we could pay 20 grand a year for Streamline to fix it. It's just not an option. So we are talking to at least one other agency or one other company that Jasmine was able to find. And they were like, oh yeah, we know Streamline's game. Oh yeah. And then Streamline was also purchased by another entity that does a lot of civic websites. And they echoed the sentiment that we suspected, that those prices are going to go even higher.
Okay, well, happy that you're on it.
Yeah.
You know,
We don't,
If we
want
can
you to
find
even
something
know about
between the
things.
middle, you know, something that isn't streamlined, but is compliant and,
Right.
yeah, okay, well, you know, the cost of doing business is the cost of doing business.
Right.
If it comes to that, then,
We think that there are other options.
Okay.
It could mean, if we didn't find another option, it would mean, to some extent, we may have to decrease the amount of transparency that we pride ourselves on. It may mean that we don't put the statements from the banks and the credit cards in the finance packet.
right, we could do them in a different sidecar maybe.
We would just discuss them and they would be
Yeah.
narrative.
Yeah.
Instead of putting the actual document up.
Cause the law that passed, it says any PDF files, correct? That gets in the website? Because technically, if we have it recorded and we talk about it and it's there, does that not? No,
Apparently that's not.
wasn't it transparency, cause it's recorded and
For-
it's.
Yes, and it's not a,
accessible?
it's not a requirement for us
Uh-huh.
to have these up on, available.
Mhm.
However, one doesn't absolve you from the other. So as long as we have the PDF up, doesn't matter whatever other accommodations we've made. So that is something that we're discussing in depth.
Hey, well, we feel for you.
Mostly
Thank
for
you.
Jasmine, because she has to deal with it. And
Yeah.
then, you know, as we get ready to put documents up, we are doing our work through Adobe, which is our PDF, you know, files, right? To make sure that we're hitting the accessibility. I did one today. Olga had a certificate from training. Comes as a PDF. Okay, well, there's the logo of CSDA in the middle. That always fails the accessibility test. So I have to go in there, give it alternate text. This is the logo of the California Special District. It is the shape of California in black with a grid background. It's descriptive, right?
Mhm.
And that's what you would have to do,
Yeah.
but you couldn't do that to financial statements. You'd have to literally retype the entire thing. And that, it's just, there's no way.
Please don't make me do that.
No. No, there, I mean, that, all we would be doing is transcribing other documents from outside agents,
Right.
and that's just not viable.
Okay, we'll leave you to your madness.
Yes.
But we want you to know, in case you're hearing or seeing that Jasmine and myself, whatever, we're talking a lot about websites, this is the underlying challenge.
Very good. Tentative AB 1862.
So luckily, this is no longer an issue. I put it on the agenda because we were afraid it was gonna come forward to the assembly. I got a text actually from Sarah, our obvious of ACHD. The Monday after I think we posted this, or the
Mhm.
weekend, something, that it got killed. The legislation was specifically drawn so that healthcare districts could not enter into an agreement with a public, private, for-profit, nonprofit, whatever kind of entity if property tax or public dollars would be used.
Oh, they want us not to collaborate?
So they, yeah,
Exactly.
Mhm.
can't,
Um,
with anything that we're doing right now.
Right,
But
us, Palomar, Rosemont, Tri-City, almost every single
Yeah.
special health district in California would suddenly not be able to have any level of partnership. So it was a very poorly written bill. It was brought forward, by Tasha Barner, who is the representative who kind of covers Oceanside.
What's her beef?
Well, from what we came to understand, it was brought forward by a previous colleague of the assembly who thought she might be a good sponsor for it. Without her understanding the whole scale of it,
Ramification.
which is why it was just being brought forward. Once Sarah reached out to me, I reached out to Jean at Tri-City and was like, hey, your rep is, you might want to look at this. He knows the assembly member well, was able to have a discussion with her office. ACHD was able to have a discussion with her office, and I think they all suddenly realized how poorly written it was. It was being brought forward to address a specific problem.
It's always the thing.
a specific
Micro
problem and
problem,
complaint.
big legislation.
Right, that actually had to do with tenant and the Desert Healthcare District. And that particular, wrinkle,
Tenant being a medical services provider and the desert having
Health District,
a
right,
collaboration,
right.
and somebody didn't like it.
Something was awry, and most recently, and it had already gone to the voters, tenant will be purchasing the actual hospital from the district.
Ooh, here we go, yeah.
And that actually went through the vote and has already been decided, but there was some lawsuit, and I think somebody was disgruntled. And so they thought that this legislation could fix it, and that is not how you fix it. So I put it on the agenda in case we needed to take an immediate stance. Luckily we don't, the bill was pulled,
Yeah.
it's dead, we don't have to address it, but I wanted to make sure that, because this is the government,
Yes.
anytime if we have lead time where we need to take a stance, I will always bring it to committee. If we are brought forward something and we need an immediate reaction, I'll usually talk to the chair and say, hey, this is what's going on. We're being directed by the appropriate ACHD, CSDA representatives who know the legal landscape to say, this is not a bill that's gonna support you. We need to take a position, and unfortunately, we need a letter of support or opposition
In
either
the
way.
next 2 minutes.
In the next 2 minutes. Then it usually will come to me and I will usually do my best to communicate like, hey, we're gonna put this forward. This time we had time and then luckily it died.
Okay.
So, yay.
Died an ignoble death.
Yes, it did, because it would have been disastrous.
All right, having completed the discussion items, board comments and future agenda items. Do you have anything? Would it be okay to ask questions about the grant?
Sure.
Have you dived in yet?
No.
Okay, then this is I probably should ask you just one-on-one. I don't wanna keep people. I just had some questions I'm a little confused about the scoring. I love the thing you did. And the packets are looking really good. It's a very efficient way. It's good. I'm glad. My whole dining room filled with
Binders and papers, yeah.
No, you have to carry it around. You
Yeah.
have to go to the bedroom.
Like a baby.
It's like a baby.
So anywho,
I mean, I have it, but.
okay. All right, well, oh, you've got the scoring?
Yes.
Did you bring it with you?
No, I
She
printed some
just-
out for, I have extra copies here printed
Oh,
for you if
okay.
you want them.
Oh, okay. Here's my confusion, maybe we can clear it up. So statement of need gets a 1 to 5, right? What are these lines for? Am I supposed to be assigning points to each of these?
Yeah.
To each of these subsections?
Yeah.
We didn't do that before.
We did in a slightly different format, but we just made it 1 or 2 big questions. So those questions are more well-rounded about the entire scope of that document.
Okay, so I can spend up to 5 distributed among these
No,
categories?
no, no. Each one of those is a 1 to 5.
And then the whole area gets 25.
Right.
Okay. Okay. That was my question.
That just helps to,
So there's,
so it's not going, it's 25 points is the weighted for that entire question.
well,
You're-
because some of them have 4.
Right, it's not going to be, they're not equally weighted across that. It's gonna be, I came up with 20, okay, but divided out of 25, it gets you whatever that weighted score is gonna be. You don't have to do the weighting, we're gonna do the weighting. The idea is on that question, is it a meets expectations 3? They excelled in that part of the statement of need, this part wasn't as good.
Okay, so I'm not understanding weighted. I'm sorry, I skipped a beat there. So I've got organizational capacity in 2 categories, and this is up to 5 points.
Right,
So I can do 2.5 and 2.5 if I want to.
right, or you could do 5 and 5. It doesn't matter.
5
because
and 5.
5 and 5, because when it gets over to the weighted, I'll do the math that will allow whatever that average score is, then I'll divide that and be able to come up with a weighted score over here. I'm not asking you guys to do that because I already have the formula in my spreadsheet.
Okay. just
So that's
this part.
different.
Yes,
Don't worry about it, just for it. Right,
I stepped on the chair.
Just what,
just for it.
Just score it. That's all you have to do is just score it.
but assign points for each of these lines. Okay. All righty, anything else you already noticed about the grants?
No.
We wanted to ask about, but I asked.
And I printed 10 copies if you wanted paper copies for the score sheets.
Yeah, I'll do that. I haven't decided whether I want to do it online or not, so I'll take those.
Perfect.
Okay. Any other future agenda items or comments, Linda? Nope. Anything else from any of you that we need to know about?
We can just give you the brief update on the two coordinators.
Please do.
Teresa did kind of an initial phone screening of several applicants and then set appointments for physical interviews. We did three?
We've done 3.
We did 3 already. We've got one on tomorrow. So the top
Yeah.
4, right?
Friday, I think.
Friday. What's today? Yeah,
Wednesday.
Friday. Sorry. So we'll have had 4 candidates that really rose to the top. We were blown away by the exceptional candidates we received.
Nice.
The skill sets, phenomenal. The education and experience to support those skill sets, phenomenal. Bilingual candidates,
Phenomenal.
right? Bilingual candidates
Great.
on all of them.
Great.
Which,
Yes.
so not that we have decided, but Friday's candidate has really is gonna have to kick our socks off to beat the other 2 candidates right now that are selected. One of the candidates is a youngish woman. I shouldn't say young, doesn't really matter her age. I'm just old, so I call her young. Lives here in town, which is wonderful.
Oh, yeah.
The other candidate is a wonderful young gentleman.
Oh.
So we could finally
Yeah.
have a gentleman work for the district, which would be nice. I think that provides a nice rounded opportunity, especially for program staff. So Teresa and I have agreed on the candidates so far. They've really just been impressive, really impressive.
Excellent.
I mean,
Okay.
it was a good vibe check. I think they
Yeah.
would fit well within the culture of the team.
Yeah.
They get the mission, very supportive of the kinds of programming we're doing. The right energy, just really so pleasantly surprised because obviously replacing Bianca was gonna be a challenge.
Yes.
Yeah.
And you've been very smart to rethink every time there's a resignation, to rethink and good. That's the way we keep moving forward.
Yep.
We're going through that with the arts group too.
Right.
Yeah.
Right.
So, good. I'm very excited then.
Yeah. So that was the update on that we were talking about when you came into the room.
So you might be even coming to a conclusion on Friday.
Yeah.
Or
And
we said like next week, so.
making
maybe
an
on
offer
Friday.
the following
Yeah,
week.
Yeah, yeah, that's what we're hoping to do, to not lose momentum.
I was gonna say uninterrupted flow.
Yeah.
Very good. Very good.
Plus
And-
Teresa's really carrying a load right now. so.
Yeah. Yeah.
Okay. It's a Teresa Bianca.
Teresa Bianca Durasitano. We just changed her middle name.
Okay. Well, good. Anything else you need us to know, want us to know?
Anything?
No.
Not really.
Okay.
So we're gonna be without Jasmine most of the month of May. I'm gonna throw you under the bus here. She, is doing a master's program
Mhm.
and at, what do they call it? Your trip?
Well, it's pretty much a business capstone,
Business
Okay.
capstone project. She will be going to Georgia,
the country.
the country, not the
Oh,
state.
the midnight train to Georgia?
Well, it'll be like a midnight flight mostly. 'cause It's a long flight over there.
With
an 8-hour
Um,
Yeah, 24-hour travel day.
She and you've got a cohort of 2 or 3 other students, or how many others?
There's 15 of us.
15.
15.
15. Yay, 15. There's a big
Big cohort that will all be traveling, but obviously that's a big trip. So she'll be gone most of the month of May. So she is front loading our social media posts, working to get all the flyers and various things. So she's been saving her PTO like a crazy person.
Very good.
Um,
And since it's a capstone, are we saying that that is the last part of the program?
It's my last big part, yes.
Okay, so graduation in the fall,
Yes.
and where will that take place?
San Diego State University.
How exciting for you. I graduated from there, and we had a streaker at our graduation.
No.
A streaker. You know what that is?
Yes, so I had one at all for my undergrad.
Oh, at your undergrad?
Yes.
Streaking is apparently popular at SDSU. No Aztecs.
I think it's a San Diego thing, I imagine.
I think it is.
I'm gonna say,
Must
we
be,
didn't have that at
right?
Fullerton.
No.
Well, we will be thinking about you through the whole May, and
Yes,
just have a great time, you know?
I will.
It's pressure,
Yeah. 'cause I
but
was
it's gonna really pay off, friend. That's great.
She's got a little bit of fun travel with it, so
Good, good.
we're happy that that gets to be tacked on, because she's a travel bug.
Yeah.
Loves it.
Yeah.
like, we gotta make use of that 24-hour travel day somehow.
Yeah. Great. Okay. Adjourned at 6:10. And then, oh my lateness, I got lost.